do anything because the private sector is so much more efficient, and you hate to say how could it get worse, but that's sort of what I look at. And we use the word system just because it's an easy word to use, and I don't think anybody up here really believes it's a system that operates with any sort of sensibleness. But yeah, how could it be so much worse? We don't like to think about things like rationing, but yet that happens all the time. Those 18,000 people were rationed. They were rationed because they didn't have resources or access to resources. The most severe burden is carried by the people with the lowest incomes, and that's pretty much true of any problem in society. But this is not a poor person's problem. I have a very comfortable income. I would consider myself sort of the lower end of upper middle class or something, And my health insurance has gotten worse over the last few years, and I spend a lot more out of pocket than I used to. I am increasingly making decisions based on how much they're going to cost me. And I guess to some extent that probably is how it should work, because the other thing that we don't talk about is how bad information is. And so if you go to the grocery store, right, you kind of buy what you want and you spend what you have. And there are certainly people who don't have enough to spend. I'm not questioning that. But you don't just sort of grab stuff off the shelf without knowing how much it's going to cost you. And you make a decision relative to your grocery budget, how much you're going to spend and on what. And we don't have a system like that in the United States. There's just not. As a consumer, I can make some decisions about my own health care, but I'm probably the least qualified person to do that. And I'm making those decisions often without knowing even what they cost. So there's a lot of room for improvement. Those are systemic issues, right, that need to be fixed, not in Fort Wayne or in San Francisco or anywhere else. They need to be fixed everywhere. But I do like what Tom Henry is talking about with some of the things that we can do at a local level, and I think that we need to make those steps as well. So that's all I have to say. Thank you.
Just want to follow up on a point you made, that having health insurance is no guarantee you're going to get healthy and get coverage.
Right.
So there's two issues here: no health insurance at all, or money to pay for your health coverage, and having health insurance and the insurance company finding every loophole with the dreaded pre-existing condition. Let me tell you, I'm very familiar with that one. And they'll find pre-existing condition just about anything. So thank you. Dr. Walker?
Yeah, I'm a surgical subspecialist, which is a little different, compared to what Dr. Hayhurst does. So I don't see the life and death things, but certainly in our office, as an eye surgeon, we see people routinely going blind in Fort Wayne that should never, ever have gone blind, in spite of an open-door policy in our office. And I think an additional problem, in addition to what everyone's talked about here, is simply the size of this room. Healthcare is the number one or number two issue politically right now, according to polls, and there's maybe, 30 or 40 people here? Thomas Jefferson said that we don't have a government by the majority, we have government by the majority who participate. And I think the other thing we need to address is the people that need the help the most have zero voice. And anything we can do to get them involved, we've even spoken to an Eagle Scout who's looking for a project, want them to get to the free clinics and start registering people, give them little postcards to send to Congressman Souter. I think that's another part of this battle. We can all agree that the system is messed up, but nothing's going to happen unless people make some noise.
That is the purpose of this forum, is to give people a voice. So at least the people here have a voice, and hopefully that will carry over to some other stuff.
My name is Edith Kenna, and I am actually a licensed clinical social worker who is trained to provide therapy. However, I am a social worker, which is different than a therapist. A social worker is a problem solver, is an advocate for those in need, for injustice, for oppression. We just got slammed in the Journal Gazette by George Will because we have a code of ethics that mandates that we advocate for people who are oppressed, people who are ill. I just finished that letter to the editor, my response. However, I'm glad I'm lost, because on this issue, I am a rabid bulldog. This is the issue for the rest of my life. Anyone in this room may borrow my energy, and Tom will attest to this, and I will have plenty left. I was not always for single-payer universal health coverage. There is one proposal in Congress that is that right now, H.R. 676. I have lots of information here so you can understand that. My daughter, my gorgeous, beautiful daughter, in 2001 was having trouble walking. And she's a big jock, and so she thought she did it running or tennis or something. So she's going to school and crying. She's a kindergarten teacher. She's got this cast. She's got that cast. She's got this medicine. She keeps going to the ER in the middle of the night. She keeps going out of network, and her mother's going, oh, don't do that, don't do that. Her pain is so intense. Another person in the ER said, oh, you better go, and I'm going to give him a plug here, Dr. Scott Carr at ONE. So Abby, her name is Gabrielle, I call her Abby, she went there. It was bad. He did a CT scan of her foot and her talus bone. I think it's this bone, Dr. Walker, someplace here.
Don't ask an eye doctor.
Looked like, looked like
You're close.
Swiss cheese. And they had to do surgery to determine what was wrong with her. And he said, I'm going to tell you right now, there's one or two very serious things wrong with her. It was a very advanced and severe case of rheumatoid arthritis, which is not like old lady osteoarthritis that I have. It is an autoimmune disease where the lining of your bones, can attack your organs, and she was very sick. We went to IU Med Center. The rheumatologist came out and said, are you sure she's only been complaining for 3 months? This is very, very advanced. This was in February. He suggested a medication for her, which took until May, which is probably actually short, for me to fight to get this medicine for her. It required the downloading of the 3,000-page HIPAA, my reading it, being the paralegal to the attorney that I retained, reading the FDA. Well, anyway, she got it. She was crippled for a year. She could not walk without crutches. She could not work. She was in a wheelchair. Now she's wearing high heels, going dancing. This medicine is not, it's a choice between quality of life. It has its own serious side effects, and the medication is not, she is not cured. In that 7-year period, I am always reading health insurance policies. Every article about health insurance, I had to clear a room for articles on file. I did not come to single payer easily. I just wanted everybody to have what I had, what my daughter had. My daughter works for Fort Wayne Community Schools, the largest employer in the city, and she has to get an infusion of a medication that is obscenely expensive every 6 weeks. She has a co-insurance every 6 weeks of $350. What the insurance company is not paying, because they have a contracted rate with Lutheran is coming after her for. Now let me let you know, Lutheran is owned by Triad, who was just acquired by Goldman Sachs. And I will be darned if Goldman Sachs is going to wipe out my daughter. I have just completed my 5th tee-up for a lawsuit. I have liquidated one of my retirement plans and probably have to liquidate another one. I have never lost. I have never even gone into court because they are trying to not pay. That is how they make money, by not paying claims. It is very complicated. It's clear. They make money. They came after me. This is managed care at its best. You manage to make money if you deny care. This is baloney, and we're over it. When people say this is socialized medicine, that is what's going on now to scare everyone away. Medicare is the most successful health insurance plan in the country until they allowed privatization of that blasted Medicare D plan, who is right now getting blasted by CMS, which is Medicare, Medicaid, and they are doing audits of these private insurers and have found, lo and behold, they have been gouging, okay? Surprise, surprise. It is socialized medicine. That is not socialized medicine, Medicare. Do we have socialized education? We have public education. You can get more education if you're rich, but some of us who were not born wealthy did pretty darn good in public education. Okay? We do not have a private fire department. We have a public fire department. It used to be private, but when the rich dude found out that the poor dude's house could catch his house on fire, that became a problem. That's just what's happening in healthcare now. The reason you're all here is because the middle class is getting touched. We're getting worried because, as Eve says, and as I know, poor people have always been hosed because they didn't work, they were lazy, okay? We're not lazy, we're working. What's the matter? What happened to my daughter? She's not bad. She is good. She tries to work, and she's good. All right, do we have a socialist army?
Well, kinda.
Well, we don't know about that, but they are at least more respected than the mercenary army that is hired. Mm-hmm. Do we own a road? No, we sell roads, but these are public things.
Used to.
Sometimes the public must take over when the private sector cannot deliver the goods and cannot make a profit. They can make a profit by lying to us, scaring the living out of us. There are more than 2 businesses in the United States that should be making money. Not just pharmaceuticals and not just health insurance companies. Let me read you right here, and not just Goldman Sachs gouging my daughter. We'll just see about that. I have all this information for you, but U.S. largest health insurer, United Health Group, CEO's pay in 2005 was $122.7 million. Is that gouging? John, I don't think Dr. Salk made that much money. I doubt it, for curing polio. This is not right. People in this community are very religious. People in this community, there are many people who are pro-life. Well, what is this? Pro-birth or pro-life? If you want people to live, then they must have access to life. There must be 2 things in this country that we have to keep it American. Public education, the opportunity to be educated and to learn, and the opportunity to be healthy. If we do not have that, this is not America. This health insurance, single payer, universal, is not a partisan issue, Democrat, Republican, no matter what they're telling you. This is an American issue. We cannot be strong if we are sick. Now, I have tons of information. I have 160 people on my listserv here. Hoosiers for Common Sense Health Plan is a grassroots movement through the whole state. We're part of Physicians for a National Health Program. We are moving. We are having a meeting November 8th. There's another meeting November 14th. If you have a phone number or a listserv, I gotta have it. And then you can tell me to quit bugging you. But we need people. I want to end now because I could go on forever. Here is a little letter to me from Congressman Souter, because I've been having a big fight with his office about the ship. Now, if we had H.R. 676, okay, which is Medicare for all people, very simply on one page, you can be told how this would be paid for. I have been barraging him with phone calls, letters, had a big fight. Finally, he says, "Dear Edith, thanks for your notes. England and other nations are altering their healthcare systems because they are broke, as well as not working." I don't know what that means. "We will continue to work to maintain our superior system," which is a non-system of illness management, but cover those who are poor. He just voted for children not to receive health care.
Yes. And
I have information here, so please at the end come up to the table.
I just want to say a few quick things, and then anybody has a question for Karen, she's going to have to leave. But Mark Souter said in a video that we were going to show that
the United States Congress is not going to follow Michael Moore's crazy principles.
basically he's talking about in sicko health care for every single American from birth to death. That is really a bad thing, according to Mark Souter, who, keep in mind, votes himself these very same stupid things every single one of them. He has the finest health care plan in the world, all those senators in Congress who can't even give poor children health insurance. And I was watching C-SPAN, and they have all these excuses. Well, you know, the way the bill was written, right, number 368721, if they just change that, how long does it take them to vote $140 billion more dollars to the war in Iraq? 5 minutes. Do they say, oh, there's a rider here, there's a clause? No. No. So there's a deep, deep problem here with our country and its attitude toward its own citizens. So anybody have a question for Karen?
I'm wondering, beyond what we've already heard about what happens if you do go to the emergency room, is also what happens to a person who has no insurance and very limited income or no income and very limited assets if they have cancer, or do they get chemotherapy someplace here in town still, even though they can't pay for it?
I can answer that question. She gets it, but we had to sign our household to the hospital.
Yeah, we should hear that.
Yeah, I still am paying for my COBRA, which has been since July, $6,000.
And we had to sign a notice stating that they could repossess our home if we cannot make the bills. We paid all of our life to own this home, and now we can. It's
better than any other theoretical answer.
Or even, which they can't guarantee she's going to be healthy. They just
Right, I understand that, but what happens if you have no assets? Will you get the treatment?
Well, may I say, as a social worker, 3 days before a woman died who had cancer, Medicaid had decided, she had Medicaid, okay, which is for poor people only. Medicaid had decided that her experimental care that she had been receiving, keeping her alive, staying in her home, taking care of her daughter, that it had expired, that was it. So 3 days before she died, she came into my office at the office of Dr. J. Patel, a psychiatrist, where I moonlight, because I don't work enough. So she could bring her 9-year-old daughter so that we could talk about her daughter's fears. And I said to her, "What are you afraid of, honey?" "That my mommy's going to die, isn't she?" And I said, "I think your mommy is going to die." And her mother said, "Yes, I am going to die." Because Medicaid had decided to shut her off. Yes, you do die. Yes, there is a whole article, and when you come to the next meetings, I received that from the American Cancer Society about women who have breast cancer and no health insurance. And the American Cancer Society, right now, Eve, do you want to talk about what they're doing? You must have seen their ads.
Indiana State Department of Health has a BCCP program, which is Breast Cervical Cancer Prevention Program for women. Now, if I have the women come into the clinic, they have their Pap test there, they qualify for the BCCP program. If they have a problem, the state will pick it up through emergency Medicaid. If, for example, I have a lady come in who went to her own physician or some outside clinic and they found cervical cancer because she didn't initiate it with the BCCP, she's not covered.
I had cervical cancer 15 years ago, and I had great health insurance and great health care, and it was early detected, and I went down to the IU Med Center, and I'm very lucky. But my roommate in the hospital wasn't so lucky. She was a woman from southern Indiana who had not had it early diagnosed, and this was 15 years ago. I'm sure that she didn't make it 5 years. I had surgery and I was done, and had 6 weeks off in the summer, and I was okay. She was in for inpatient chemo the week that I was in for surgery, and it was just, I'm confident that she didn't make it 5 years. And so it's not just a matter of whether you get access to the health care, it's when you get it, right? And so because it didn't cost me, maybe it cost me $20 or something to go to my regular annual exam. But she didn't have that luxury, which really shouldn't be a luxury, and she didn't make it. So I think that's the other thing that happens if you don't have good coverage, is that you wait until it's too late, and then it doesn't matter whether you're covered or not.
Since I have the mic, I want to throw in a comment. I heard Edith talking about single-payer national health care system of some type, and of course the broad, I think, base upon which we all agree here is that every American does need, without question, to be provided with affordable health care. There are a lot of different ways to get there. I've talked about some of those in the past. Single-payer national health care is looking more and more sensible to me when you think about, for instance, a Medicare for all system, Medicare with 3% overhead compared to 25 to 30% overhead for a private health insurance system. I sometimes talk to physicians about that, and they say, "Oh, the government's going to